Good evening, everyone. My name is Simiran Choudhary, and I welcome you all on behalf of Voice of Healthcare to a new episode of The Big Idea Voicing What's Next in Healthcare, presented by Voice of Healthcare. So, this episode is a mini virtual, crisp, yes, insightful series where we feature leading healthcare experts and innovators who are making a significant impact in healthcare space. So, join us as we will delving into the valuable insights and experiences. And for today's episode, we'll be diving deep into the intersection of healthcare and finance with none other than Mr. Shrey Jain, co-founder of HealthCred. Shrey has been at forefront of revolutionizing healthcare financing, offering innovative data-driven solution to ensure stable cash flow for hospitals, manufacturers, and distributors. His vision aligns with improving financial inclusivity in healthcare and bridging the working capital gap for key players in the industry. So let's explore how Shrey is shaping the future of healthcare through financial innovations. Welcome to our show, Shrey.
Hey Simran, thanks a lot for having me here. It's an honor.
Thank you, and it's an honor to have you with us. And we are very much excited to know more about your journey, about health, cred, and your vision. So, starting with, could you share the story behind founding Health Cred and what inspired you to create a platform focused on healthcare financing?
Sure, absolutely. Thanks, Simran. So, as an entrepreneur, I've always been slightly biased towards building in the healthcare space. And when we were starting off healthcare, I continued to have that personal bias. I strongly believe that there is a key gap in the Indian healthcare ecosystem where strong impact play can be created. So, the idea of HealthCred started with the notion that health insurance penetration in India has grown rapidly in the post-COVID scenario because of four key strong macro tailwinds, which are socio-economic and political in nature. One, there is a growing middle class that wants to adopt health insurance as a mean to avoid high out-of-pocket expenditure. Uh, we have a greater penetration or mandate from IRDA for health insurance to be also available in tier 2 and tier 3 cities. Then there's this IRDA mandate of universal health coverage by 2030 that all the ecosystem players are working towards, and all in all it is all directed towards achieving sustainability development goal target 3.8, which talks about patient financial inclusivity in healthcare. Now, as health insurance in India grows, the working capital associated to providers or healthcare providers associated to insurance repayments also grow, because there's usually a delay that is attached to that receivable against a cashless health insurance patient. While cashless health insurance is amazing for patients and it is going to be one key tenet of creating impact in the healthcare ecosystem, addressing this working capital gap is also going to be critical in order to truly achieve truly turn the dream of universal health coverage a reality in our country. And that was the basic thesis that we started off HealthCred with. And today we are working across the healthcare value supply chain with providers, pharmaceutical manufacturers, as well as distributors as well, in order to address different working capital gaps in the ecosystem.
That's great. May I know when? Because I believe the idea of any business comes with a situation or any problem, right? So I just want to know, when did you get the idea of health cred, or what exactly the situation was when you got inspired? I need to get this done.
Absolutely. So initially, when we started off HealthCred, it started off on a very different note. Frankly speaking, the idea that we started off HealthCred with was one very specific thing that also arose because of not my own personal incident, but a friend went through that particular incident, which was addressing the maternity requirements of corporate employees, because maternity coverages are not there in retail health insurances and group health insurances, which are usually offered by employers. There's a limit of about 50 to 75,000 at max on coverage for maternity. Actual cost of delivery is much higher than that. So that was the basis with which we started HealthCare, which was to address the gap that is created by the non-insurance component of maternity or delivery incidents, basically. Uh, slowly, when we started the conversations with hospitals, we began to dig a little deeper. So in like we had a conversation with close to 86 hospitals wherein we collected primary data in order to understand what the problem statement was in a deeper manner. And that's kind of where we realized that the situation of working capital gap or capital gap in general goes a lot deeper than just addressing the maternity requirements of corporate employees. It has got to do more with addressing the working capital gap of providers because of those insurance delays. And providers are going to be the key component of actually addressing and making sustainability development goal target 3.8 a reality. And hence, it was more important for them to be able to address their working capital gap, which was kind of like that eureka moment, I would say. So this was this one particular hospital in Jodhpur wherein we analyzed their cashless revenue flows prior to COVID, which was December of 2019, and then we did a month-on-month comparison till December of 2022, and the percentage or cashless health insurance patients almost tripled in that particular period in those scenarios, when which kind of made us think a little deeper on that particular idea, and transition HealthCred as from a B2B2C product to a completely B2B product, wherein we wanted to work mainly with providers. And if I were to tell you, like, the basic principle of universal health coverage or creating impact in the healthcare domain is driven by four A's: affordability, accessibility, availability, and acceptability. Affordability and accessibility are what we are very directly targeting. Availability is being targeted through a growing healthcare infrastructure in the country, and acceptability or quality of patient care is being targeted through accreditations that are being driven by the government. So the two key components of healthcare impact are what we decided to go ahead with through our working capital solutions for providers.
And I think that's great. You guys are going to a great direction. Results or the performance, which I just, I was going to the websites and everything, so it looks fantastic. So congratulations on that.
Yeah, thanks a lot. I think we're just trying to do our bit. Obviously, this is not a single player-driven play. You're talking about addressing the gap of a $368 billion market today that is growing to almost double in the next 5 years. So there needs to be like a more cohesive sort of a play wherein people across the value system are actually contributing, and there has to be like multiple players existing like us in order to actually address this. This whole gap associated to working capital, frankly, at this point in time. But yeah, I mean, I'm glad we're taking a step in the right direction at this point.
And I guess it is required because the things you just mentioned, why this came out, and then the post-COVID thing, during the COVID things were how they were. So I think this is actually required, and it will definitely will grow. It is going in the right direction. It is required. So yeah. And how do you see the role of financing in improving the overall quality of healthcare services, particularly for tier 3 areas, or we call it under reserved areas, where healthcare people just see it, जो गांव के छोटे मोटे हॉस्पिटल्स या क्लिनिक्स अवेलेबल होते हैं, उस तरीके से जहाँ अब अवेयरनेस नहीं है, अवेलेबिलिटी नहीं है, मोस्ट इम्पोर्टेंटली.
Absolutely. Again, going back to the original thesis over here, as you very rightly said, spokes of tier 2, tier 3, and tier 4 is a heavily underserved area when it comes to accessibility and availability of healthcare. 70% of all beds in the country, hospital beds are in the country, are actually focused in tier 1 and tier 2 region, which is what creates this sort of a massive gap. Uh, Again, going back to the four A's, like we mentioned: availability, accessibility, affordability, and acceptability. Availability is going to be targeted by new healthcare infrastructure. Uh, 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 Accessibility is going to be targeted by the fact that the government is moving towards a space wherein they don't want people to travel more than 5 kilometers or less than 30 minutes, or more than 30 minutes to actually get primary health care. So both availability and accessibility are oriented to infrastructural development. Infrastructural development will obviously come at a capex, and hence financing will continue to play a very, very key role in order to address these two A's of creating healthcare impact and universal health coverage. Now, coming to affordability, affordability is what is being targeted by the presence of healthcare insurance. Now, the moment health insurances are there, there are usually three types of health insurances in India. There's a private health insurance, PSU health insurances, and then you have your government schemes, which could be of varying types. It could be a central government scheme, it could be a state government scheme, it could be a public-private partnership model in which healthcare service providers like dialysis chains and diagnostic chains might be working as well. Uh, now, affordability is greatly being driven by insurances, wherein as an insured, I can make sure that I don't have to pay in real time, or I only have to pay a marginal amount in real time, and the rest is being taken care by my insurance provider to whom I'm honoring my premium payments. But as the accessibility grows through cashless health insurance, it creates another gap on the provider side, which is a working capital gap that needs to be solved for. So hence, affordability also would require financing. And the last is acceptability, which is quality. Quality comes via accreditations, and accreditations come at a cost, because a certain level of capex investment has to be done in order to be able to get those accreditations in place. So all the four A's of impact will in fact be driven only through improved financing solutions.
And for that direction, I believe it would require a lot of hard work and time. If in constraint of time, I have to ask how much, if you're particularly targeting a tier 4 city or an area, how much
Mhm.
time will it require to get all these things done and actually be available there?
So, I mean, again, it is a time-consuming process. Like one of the best examples in our country that I have seen of execution in tier three and tier four cities is this hospital chain in the northern part of India called Ujala Cygnus. The
Yes.
way they have been able to create access, like they have been able to target like all four tenets of impact, which is availability, acceptability, affordability, and accessibility. It's a beautiful thing that they have done, and they've been at it for a relatively long time. Now, to quantify as to exactly how much time it will take is also dependent a lot on the policy framework and the state of operation, as well as the central policy framework, a lot of which is also going through major flux in terms of changes in order to create impact oriented towards healthcare for universal health coverage. But yeah, I mean, with the right impetus, it actually can be it actually, like, universal health coverage can be a reality in the next 7 to 8 years as well.
And I think you said it right. A lot of policy frameworks and the new judgments and every other thing plays a very important role. How will this, will be to execute or implement on the ground? So,
Yeah.
and then time also depends upon the legal and the governmental work, which takes a lot of time and paperwork from here and there and everything out there.
Absolutely, absolutely. There is the bureaucratic time work. There is, like, obviously, like, the policy framework that does take its own time, and it should, because, like, it's something that will create like that has what do you say, a ripple effect on the downstream as well. So it has to be like something that is very well thought, which I think is happening in the current landscape as well, which is why multiple what do you say, PPV partnerships, chains like Ujala Cygnus and the likes of those are now starting to come up. There is a greater focus on penetration of healthcare insurance in tier 3 and tier 4 cities. So say for example, I'm sitting in a city like Delhi, but I might have my parents in a small uh, in a village close to Rajasthan, where my family, in a village close to Jodhpur, where my family hails from. So I, like, usually if my insurance empanelment is not there in Jodhpur, I might have to call them to Delhi in order to get the treatment done, because I mean, there is a greater penetration of network providers in Delhi as compared to Jodhpur. But as the penetration increases in a smaller city, they don't have to travel a day and a half in order to get that treatment done now.
That is absolutely correct. And I think that's what HealthCred is aiming for.
That's the key idea. I mean, targeting all the four A's of impact, and yeah, driving that particular sort of availability, driving that particular thought process as well, in order to be better aligned and better prepared for SDG 3.8. Yeah.
Moving on to my next question, I believe we have discussed parts of it. But how do you think healthcare financing models can further evolve to bridge the gap between healthcare delivery and the patient's affordability?
Like I said, I mean, obviously, like availability is going to be critical, and impact-oriented financing, as well as like some, what do you say, policy leeways from the government's end in the form of like tax holidays and stuff like that would be critical for setting up better infrastructure in the smaller cities. So yeah, financing would play a very, very crucial role in that particular side of things. Having access to health impact oriented capital is going to be critical as well for that matter, because I mean, an impact oriented capital, the expectation of returns are relatively lower as compared to like other form of capital for that matter, like which would be higher return oriented and less impact metric oriented. The good thing is that there is a lot of flow of foreign capital in the country, as well as local capital that is getting directed towards this particular reason, which is where availability is getting addressed. Affordability is being beautifully addressed at this point of time through government healthcare schemes as well, wherein schemes like Ayushman Bharat and PMJY are also coming in addition to the local state schemes like Rajasthan might have an RGHS, or Maharashtra might have Mahatma Jyotibai Phule Jan Ayog Yojana, and the likes of those. So yes, both of intervention at a policy level, at a private level, and a combination of the two, driven by stronger presence of impact-oriented capital, is going to be critical for availability and affordability.
Thank you for answering that. But when it comes to the future vision, so how do you envision the future of healthcare financing in India? And what role do you think healthcare stakeholders like HealthCred will play in shaping the future of affordable healthcare in India, apart from the government schemes we have? So, like you said, it is quietly being affordable because of the government schemes which are available
Hmm.
in different states.
Right.
But apart from that, how it can help in shaping the future of affordable healthcare in India?
Absolutely. So at HealthCred, our long-term vision is to work towards building India's first healthcare-focused small finance bank, in order to be able to have the like capability to better underwrite healthcare institutions as well as other members of the value chain, so as to be able to offer better, faster capital as and when the same is required, because that is going to be critical for any kind of a development in the future. One thing that I really take an example from is like the two domains in the PSL sector, which is MSME and agriculture at this point of time, which are in the priority sector lending. They have grown and shaped up tremendously since 2017 through the presence of small finance banks like AU, Sarvodaya, Ujjivan, and the likes of those that have critically focused on these two particular segments, because there was also an impetus in order to create an impact on that particular domain. A similar kind of an impetus creates the need for a small finance bank that has the capability and that has a stronger capability to underwrite and better underwrite healthcare institutions, not just the provider ecosystem, which is hospitals and healthcare service providers, but also the pharmaceutical and consumable value chain completely, in order to offer better and faster capital. So that's how I see healthcare financing evolving in the longer run.
Thank you so much. And moving on to my last question, that is, how can healthcare startups ensure their solution addresses the real world problem, right, while being scalable and sustainable? As
Hmm.
someone leading innovation in healthcare financing, so what advice would you give to aspiring entrepreneurs out there who wish to make an impact in the healthcare sector?
So one phrase I was told, which I keep very close to my heart, is that impact always has to be accompanied by sustainability. Unsustainable impact is not long-term impact, frankly speaking. So, having that thing, whatever venture is being built out, whatever idea is being worked upon, anything that is impact-oriented, whether it is in any other space beyond health as well, like for climate, manufacturing segment, agri, it has to be driven by sustainability with the long term vision around how the business or how the venture becomes sustainable, because it's only then that empowerment of the provider ecosystem can come into the picture. Any impact that is unsustainable in nature, in terms of like simple unit economics as well for that matter, is a very short term ephemeral impact, I would say. And like that does not really create like any kind of a long term effect on the ecosystem in general. Second, I would say is what do you say, be very very well researched, be very very thorough with the problem statement in itself. Make sure that you validate it not just via secondary data but via primary data collection as well, in order to actually be able to pinpoint and say that yes, this is the problem statement. Because the problem, like I said, like the ecosystem is massive, but there will always be a morphine problem and there'll always be a vitamin problem. So go for the morphine problem and identify it well. So yeah, those are my 2 cents on that.
Thank you so much for answering all my questions and patiently answering them all and all those questions. And thank you because we have two more questions from the audience. I'll just take that. So it's
Sure.
Mr. Prajwal. He's asking, I want to know what the scope of XR technology in healthcare industry for the upcoming 4 years, and how they are developing, and what are the developments being done so far with XR technology for improving the healthcare sector.
I'll be
It's all.
very honest. Thanks a lot for the question, Prajwal, but I'll be very honest. I'm not the right person to answer anything around medical technology. I would say I'd be happy to research more on what exact technology is, to be honest, and get back to you.
That's great, no problem. And the next question is, how do you envision the future of healthcare infrastructure evolving?
So it's got to be the first thing in the 4 A's of impact, which is availability. Like healthcare infrastructure has to evolve at this point of time so as to improve penetration in tier three and tier four cities. One thing that I read recently, that the government is working towards building 3,000 new 100-bedded facilities in with the sole purpose of improving the bed to patient to bed ratio in the smaller cities, as well as smaller cities and towns as well, for that matter. So infrastructure and any play in the infrastructure is something that's going to be very ambient to universal health coverage as well, and something that will go hand in hand. So yeah, I mean, I see a greater focus on the same in the next 5 to 10 years.
And you said it right and pointed out right, because every day we come up with new plans and schemes which government is trying to implement in tier 3, tier 4 cities. uh, a small village is having, going to have 100-bed hospital or something like that, or this scheme has reached to that part of the country or India in the tribal area, or some people have got availed all those opportunities like Ayushman Bharat and every other thing which is going on. So I think government policies are playing a very great role in terms of accessibility and affordability as it is being reached to the other parts. It is not the previous or the times which we heard, okay, a person died because of there was no healthcare facility available or something like that. And with the help of government schemes and startups and organizations like you have, we are reaching and scaling the healthcare everywhere possible. So thank you for that, and thank you for answering all my questions and being on the platform for us.
And thanks a lot for having me here, Samir. It was a pleasure. It was an absolute pleasure.
Same. Thank you so much.
Thanks, Imran. Thanks, everyone.
Thank